Hello, and welcome to a webinar on developing cross-sector partnerships, where we'll be taking a look at some of the facilitators, strategies, and barriers to working in partnership across sectors. My name is Melanie Sanderson, and I'm from the Ontario Public Health Association. I'm joined here also by my colleague, Dr. Kim Bergeron, who will be presenting with me today. Before we get underway, I would like to take a moment to acknowledge the land on which we are gathering and the traditional people of this land. The Anishinaabe, the Haudenosaunee, the Wendat, and the Mississaugas of New Credit First Nation. We recognize that Indigenous practices of health and well-being have been in place on this territory for thousands of years and are maintained to this day. We also recognize the special relationship Indigenous and non-Indigenous people have affirmed through treaties signed at a nation-to-nation level. As settlers, we are grateful to have the opportunity to work on this land. For those of you joining us today who are new to OPHA, I'd like to share a brief mention of who we are. As a nonpartisan charitable organization, we're thrilled to be celebrating our 70th year. We focus on providing leadership on issues that affect the public's health and strengthening the impact of those who are active in public and community health throughout Ontario. We are a member-driven organization, and we work to provide an independent voice for a wide range of community and public health professionals who are committed to improving health for all. OPHA does this through a variety of ways, including promoting dialogue and education on healthy public policy, capacity building, research, and knowledge exchange. Health equity has long been a priority for OPHA, and so we're really proud to have launched a project called Keeping Kids Healthy Through Collective Impact, which focuses on improving linkages between health and social sectors in order to better address the social determinants of health. In this project, we're specifically adopting a collective impact approach and working with 4 communities who are each implementing their own locally driven action plans designed to make changes to processes, services, or supports at the system level, which can impact health outcomes for children in the longer term. As you can imagine, this kind of complex work requires many different partners to work together. And so when we started out, one of the first project activities was to learn more about developing partnerships across sectors. Inspiration for this project also came from the work that took place as part of the Healthy Kids Community Challenge. From 2015 to 2018, 45 communities throughout Ontario participated in the Healthy Kids Community Challenge as part of the government's Healthy Kids strategy. During this time, OPHA housed the Nutrition Resource Centre, which was one of the resource centres that worked to support the HKCC communities. Throughout this work, it became apparent the important role that cross-sector partnerships played in mobilizing interventions and supporting the health of children and families. So, the work that we'll be talking to you about today are these results from our deeper dive into what those HKCC partnerships looked like and what we could learn from those experiences in terms of the facilitators, strategies, and barriers to cross-sector partnerships. What we learned through this research is now being shared with all of you, as well as currently serving to inform our next steps in our project activities on the Keeping Kids Healthy Through Collective Impact project. I'd also like to take a moment to recognize our project partners who are working with us to help make this project happen. We're working with a number of groups at the provincial level, including the alPHa-OPHA Health Equity Work Group, the Ontario Municipal Social Services Association, the Association of Family Health Teams of Ontario, the Alliance for Healthier Communities, Children's Mental Health Ontario, the Propel Centre for Population Health Impact, Public Health Ontario, Eco-Economics, and of course, the organizations, each leading their respective collectives in each local community, including Peterborough, Middlesex, Thunder Bay, and Ottawa. We are also grateful for the funding provided by the Ontario government as part of the Health and Wellbeing Community Development Program. We're now going to get into the portion of the webinar discussing our findings from our Provincial Scan. There are 2 goals for this webinar. First, to share these results, and second, to engage those participating in the live format in a discussion about experiences developing cross-sector partnerships. Our report is officially ready for you to download, and we encourage you to visit our website to check it out. I'd also like to thank a 3rd contributor to this work, Donna Smith, who was also involved in shaping the Provincial Scan. I'll now pass it over to Kim so that she can share the results of our scan and proceed with the presentation.
Hi there, it's Kim Bergeron. I would just like to take a moment to ask you to consider what sector do you represent, as we are curious to know what sector participants identify with. As this is a recording, you can't share it with us, but keep that in mind as you could look at our results to see whether or not you agree with the facilitators and barriers identified for that sector. So what are cross-sector partnerships? These partnerships consist of a cross-section of people from different professions, backgrounds, and experiences representing different sectors who work together to accomplish something more than individuals, groups, organizations, or specific professions can do on their own. They are the norm to make change happen. However, developing and sustaining these types of partnerships takes time and effort, and they are inherently complex and evolve over time. There is a lot to be learned from those who lead and develop these types of partnerships. So the purpose of our study was to better understand facilitators and barriers when working in partnership across health and social sectors, and to identify strategies to strengthen future cross-sector partnerships. In this context, facilitators are actions that facilitate the partnership to work effectively and achieve success, whereas barriers are challenges to work effectively as a partnership. As with any study, this study has limitations and strengths. For example, the list of facilitators and barriers shared in this presentation is not an exhaustive list. They represent a snapshot in time, and the answers to our questions are based on self-reported data. Strengths of our study is the sample population chosen to participate, as they have been immersed in developing cross-sector partnerships, and we had a good response rate of them sharing their experiences and thoughts. We also designed the study to meet the Tri-Council Policy Statement Ethical Conduct for Research, and developed and followed a detailed research plan to model ethical and responsible research practices with humans. We were interested in understanding how they engaged five specific sectors. Here is how the sectors were defined in our study. Participants were asked to consider these five sectors and choose from a list of facilitators and barriers to identify the ones that best represented their experience working in partnership with each sector. They could check as many facilitators and barriers as they wanted per sector. Participants also had the opportunity to identify additional facilitators and barriers. They could write their answers in a text box. These answers were analyzed qualitatively and themes were identified. We conducted an online survey. Our sample population was the Healthy Kids Community Challenge local project managers. Of the 45 people who received the survey, 22 completed the majority of questions. This is a response rate of 49%. These folks were responsible for recruiting cross-sector partners to work together to plan, implement, and evaluate activities to promote healthy behaviors among children. They also had the important role to develop, negotiate, and sustain cross-sector partnerships throughout the duration of their program. They are a good source of knowledge related to facilitators and barriers. Thank you to those who are listening to this recording who participated in our study. I'd like to do another poll question. Please consider these three facilitators and choose the one that you use the most when leading cross-sector partnerships. Here's the results of our study related to facilitators and strategies. This table shows the 5 sectors considered and the 15 facilitators generated or identified per sector in this study. The check marks represent which facilitators were identified for each sector. The report goes into great detail as to how this list of facilitators was generated and how frequency tallies were used to rank the facilitators and strategies as those most common across all sectors. There are 2 ways to read this table. One way is by sector, by reading the table from the top down following the same colored check marks. This shows the facilitators or strategies identified as effective for that specific sector. If you were interested in what worked for a specific sector, this is how you would read this table. For example, if you are interested in the healthcare sector, you would consider the facilitated strategies that have the blue check mark. The other way to read this table is from left to right, top to bottom, using the facilitators or strategies text. This way shows the facilitators that were identified most often by participants when developing cross-sector partnerships. Reading the results this way shows the facilitators and strategies that were found to be effective across sectors. This way also identifies the actions to engage folks from all 5 sectors, whereas the first way identifies those actions you can do to engage folks from that specific sector more effectively. Both are relevant for developing cross-sector partnerships. So, the 3 facilitators you considered in our poll question were found to be strategies used across sectors. Therefore, based on the results of our study, these 3 actions have the added value of engaging multiple sectors to work effectively. Whereas in our study, providing incentives was only identified when working with the education and recreation sectors. In the report, we also showed facilitators and strategies that were identified for one sector, and these are not included in this table. We also reported on how different sectors successfully work together. Here are some examples. These 2 examples of qualitative data generated of how different sectors work together. There are many more examples in the report. So you can see that the example includes nonprofit and recreation and public health and education. We are now going to move on to look at barriers that were identified. Here is a third poll question. Of the 4 barriers listed, which one do you most experience as a barrier when developing cross-sector partnerships? Please choose one. The 4 barriers you considered were found to be the barriers experienced across sectors by our study participants. So the barrier table is very similar in design to the facilitators, so you can read it top to bottom or left to right. So in this one, you can see the circle, we're showing the 5 barriers that have been experienced across the 5 sectors, whereas manipulated or dominated the partnership or competed for the lead or hidden agenda was identified as the least experienced barrier. Here are 2 examples of qualitative data generated of barriers experienced when leading a cross-sector partnership. There was a lack of a champion in time to reach out to the healthcare sector, as several respondents identified the healthcare sector as the hardest to reach, whereas some respondents didn't identify that as a barrier. And so it explains in the report that sometimes a barrier was experienced by some participants, but not by others. The other barrier identified was, or an example provided, was limited human resources and lack of time in the recreation sector. One respondent shared that they worked with a number of sports organizations and associations, and that they're often volunteer operated, so time and capacity to be part of the project and part of the partnership was a barrier. So what did we learn? Not all facilitator strategies or barriers were experienced when considered for specific sectors. We also learned by asking open-ended questions that the piece of advice our study participants would give to others who are leading cross-sector partnerships was that those who are leading these types of partnerships need to develop or enhance skills to build relationships and trust, model clear communication, develop facilitation skills, and utilize collective impact and asset-based community development methods. And these were summarized to represent the themes from all of the qualitative data provided. In the report, we do give more information around these 4 skills that need to be implemented, so you can certainly look for resources and examples in the report. Therefore, implications for practice from our study are that those who are leading cross-sector partnerships need to model the facilitators to enable effective collaboration and decrease the barriers that inhibit the development of cross-sector partnerships and weaken collaborative efforts. They need to use the findings in the study in relation to specific sectors. So if you're looking to work with a specific sector or reach out to that sector, you may want to read the tables from top to bottom and follow the colored check marks to get a better understanding of what was identified as facilitator strategies and what was identified as barriers. It is also recommended that you build your own capacity related to building relationships, model clear communication, develop facilitation skills, and learn more about collective impact and asset-based community development. So I want you to think about what practice are you most likely to do now that you've heard the results of our study, and here are the 3 choices. These are the facilitated questions that we posted in the webinar forum to generate some discussion, as well as to answer questions by the participants in the webinar.
At the start of this webinar, we mentioned that the Provincial Scan was just the first piece of the Keeping Kids Healthy Through Collective Impact project. As we continue to make progress, we'll be sharing a number of tools and resources on our project website. Among these will be the second portion of the Provincial Scan, which includes case studies to be released in the fall, along with a template for others to use in order to showcase local examples of partnership development. This webinar is also part of a series. In the next webinar, we hope to look more closely at the processes we took for getting ready for systems change, and later in the project, we'll take a closer look at the local collective impact process. We invite you to stay engaged and reach out with any questions about the project, and of course, the best way to stay abreast of all the latest activities is to become a member of OPHA. As a registered charity, we value the support of our members who benefit from access to a variety of topic-specific work groups and platforms to stay connected, as well as training and professional development opportunities. This concludes our webinar for today. We hope that you enjoyed the presentation, and we thank you very much for tuning in. It has been wonderful to explore partnerships across sectors together, and we look forward to the next time that we are connected. We've shared the report on our project website, and we encourage you to continue to check back often as we upload new resources along the way. Until next time, please stay tuned and feel free to connect with us at the following contact information listed on the slide. On behalf of Kim and myself and the project team, thank you for your participation in this webinar today.